Hi everyone, my name is Alona, and today I'll be talking about how human resource management practices improve patient safety in digital communication. As patient portals and secure messaging becomes more central to healthcare, human resource management plays a critical role in making sure that these tools support safe, efficient, and high quality care. Digital communication has become a normal part of healthcare. Patients use portals to message providers, request refills, view results, and ask questions. However, if these systems aren't managed well, they can create delays, confusion, and even safety risks. In this presentation, I'll show how human resource management practices help organizations build safer digital communication workflows, and these workflows help protect both patients and staff. Digital communication sounds simple, but it has real safety implications. Patients expect quick responses, and when message volumes get too high, important concerns can be missed. Patients may also misinterpret test results, or they may send complex medical questions that really require a visit. So the way that we manage digital communication directly affects patient care, patient safety, and staff workload. So this is where human resource management comes in. Human resource management, or HRM for short, isn't just about hiring, it's about designing systems, and these systems help people work safely and effectively. In digital communication specifically, human resource management helps create clear workflows. It helps train staff on communication standards, set expectations for response times, and helps monitor burnout. So all of these practices support safer, more consistent communication between patients and their care teams. One of the most important HRM practices is setting expectations. Patients need to know what the portal is for, and of course what it's not for. And they need to understand how quickly they can expect a response. So clear guidelines help reduce confusion, they help prevent misuse, and they help patients understand when a message is appropriate versus when they really need a visit with a provider. So this can help protect patient safety, and it does so by making communication more predictable and consistent. HRM also helps standardize workflows. This way, every message is handled the same way. This includes, of course, routing messages to the right person, identifying when something should be escalated, and creating policies for when a message should be, converted into an actual visit with a provider. So standardization in general really helps reduce delays, it helps prevent errors, and ensures that no message kind of falls through the cracks. Another key HRM practice is team-based triage. Not every message needs to go to a physician. Right, we have administrative staff that can handle scheduling questions, we have billing staff that can handle billing issues, and we have nurses that can screen clinical questions before they even reach a provider. And this approach helps reduce workload, helps improve response times so we don't have to wait for providers to respond, and ensures that urgent issues are quickly identified. Training, of course, is essential for safe digital communication, and human resource management ensures that staff are trained in any type of patient-facing communication, as well as, of course, privacy and security workflows, portal workflows, and just the use of digital tools overall. Because of course, as we know, when our staff knows how to communicate clearly and consistently, then of course our patients receive better information and fewer mistakes are just more likely, or I should say less likely to occur. Another important HRM strategy is reducing unnecessary messages. This can include improving after-visit summaries, including pre-visit labs, automating normal results, and giving patients access to symptom checker tools or educational resources. When the patients have the information they need up front, they're likely to send fewer messages, and this can, of course, reduce the overload on our team and improve safety overall. Now, when you put these practices together, the impact on patient safety is clear, right? Messages are routed correctly, urgent concerns are identified faster, and patients receive clearer communication overall. Of course, on the staff side, our staff is experiencing less burnout, which also reduces the risk of errors. So overall, HRM practices create a safer, more reliable digital communication environment. So as we all know, digital communication is here to stay, but it really only works well when the people and the processes behind it are strong. And so HRM processes help provide that strength and structure, right? It helps provide the workflows, the training, the expectations, and the support, all of which help make digital communication safe and sustainable. And without human resource management practices, patient portals can easily become overwhelming and eventually unsafe. And so in conclusion, digital communication only improves care when the people and the processes behind it are strong. And HRM practices help create those structures by, once again, supporting clear expectations, consistent workflows, and a well-trained team. And when these pieces are in place, then digital communication becomes safer, more reliable, and easier, of course, for both patients and providers. Thank you all for watching this video.